Reaching and protecting people experiencing unsheltered homelessness during the COVID-19 outbreak will require coordination across several local sectors. Lack of housing contributes to poor health outcomes, and linkage to permanent housing should continue to be a priority. In the context of COVID-19, the risks associated with sleeping outdoors in an encampment setting are different than staying indoors in a congregate setting such as an emergency shelter or other congregate living facility. Outdoor settings may allow people to increase distance between themselves and others. However, sleeping outdoors does not provide protection from the environment, quick access to hygiene and sanitation facilities, or connection to healthcare. The balance of risks should be considered for each individual experiencing unsheltered homelessness. Unless individual housing units are available, do not clear encampments during community spread of COVID-19. Clearing encampments can cause people to disperse throughout the community and break connections with service providers. This increases the potential for infectious disease spread. Encourage people staying in encampments to set up their tents or sleeping quarters at least 12 feet of space per individual. Ensure nearby restroom facilities have functional water taps, are stocked with hand hygiene materials and bath tissue, and remain open to people experiencing homelessness 24 hours per day. If toilets and hand washing facilities are not available nearby, provide access to portable latrines with hand washing facilities for encampments of more than 10 people. Provide straightforward communications to people sleeping outside in the appropriate language. Identify people who are influential in the community who can help communicate with others. Post signs in strategic locations to provide information on hand hygiene, respiratory hygiene, and cough etiquette, and request up-to-date contact information for each person. Information to share includes the most recent information about COVID-19 spread in the area, advice to avoid crowded areas if COVID-19 is circulating in the community, social distancing recommendations, hand hygiene instructions, cough etiquette instructions, and advice not to share personal items. How to recognize the symptoms of COVID-19 and what to do if they are sick, what to do if friends, family, or community members are sick, how to isolate themselves if they have symptoms, and updated information on where to find food, water, hygiene facilities, regular health care, and behavioral health resources if there have been local closures or changes. Some people who are experiencing unsheltered homelessness may be at higher risk of moderate to severe disease because of certain conditions. Pay particular attention to preventing disease among these individuals. Local partners should plan for where individuals and families with suspected or confirmed COVID-19 cases experiencing unsheltered homelessness can safely stay. These should include places where people who are confirmed to be positive and those awaiting test results can be isolated. Additionally, if a person needs to be hospitalized, a plan should be in place for how they will safely recover after discharge. Ideally, these individuals will be housed for the duration necessary, as outlined in the CDC's recommendations for discontinuation of isolation. Isolation housing could be units designated by local authorities or shelters determined to have capacity to sufficiently isolate those individuals. If medical care is not necessary and no other options are available, advise the individual on how to isolate themselves while efforts are underway to provide additional support. In each scenario, identify how to safely transport patients to and from healthcare and housing facilities. Behavioral health teams should be involved in the planning for these sites to facilitate continued access to support for people with substance abuse or mental health disorders. In some situations, an individual may not be able to comply with isolation recommendations. In these cases, community leaders should consult local health authorities to determine alternative options. When COVID-19 is spreading in your community, assign outreach staff who are at higher risk for severe illness to other duties. Advise outreach staff who will be continuing outreach activities on how to protect themselves and their clients from COVID-19 in the course of their normal duties. Staff should be taking and monitoring their temperature during the course of their work. Instruct staff to greet clients from a distance of 6 feet and explain that you are taking additional precautions to protect yourself and the client from COVID-19. Screen clients for symptoms consistent with COVID-19 by asking them if they have a fever, new or worsening cough, or shortness of breath. If the client has a cough, immediately provide them with a surgical mask to wear. If urgent medical attention is necessary, use standard outreach protocols to facilitate access to healthcare. Continue conversations and provision of information while maintaining 6 feet of distance. Maintain good hand hygiene by washing your hands with soap and water for at least 20 seconds or using hand sanitizer with at least 60% alcohol on a regular basis. Wear gloves if you need to handle client belongings. Wash your hands or use hand sanitizer before and after wearing gloves. If at any point you do not feel you are able to protect yourself or your client from the spread of COVID-19, discontinue the interaction and notify your supervisor. Examples include if the client declines to wear a mask or if you are unable to maintain a distance of 6 feet. Provide all clients with hygiene products when available, and street medicine and healthcare worker outreach staff should review and follow recommendations for healthcare workers.